Our side believes that we should not place prices on life saving, and our side believes that opposition is just simply taking away the opportunity for more people to live. Before I move on to our team's first 2 points about how it's going to have higher access, and secondly, how saving a life should not have price, I'll first like to set up this debate and do the framework. So, firstly, under the status quo, people and companies can earn profit from medicine or any kind of insurance or like care, and so these companies sometimes earn millions or billions for a treatment. And ours believes that secondly, the problem with this is that some people cannot access people, and that people are putting price on saving life. Ours believes that this can later lead to other future things and future impacts that, like I'll explain in my second argument. And so our side makes a solution of banning these companies from earning profit from these kind of medical things and medicine. However, our state believes that we can still get donations and government funding. However, we're not going to collect money from these patients, and we're not going to use it to earn profit. We're going to use it so that we're developing. No, thank you. That we're developing the basically we're developing the medicine so that more people can have access to more higher quality things, so we're not simply just taking away any kind of development at all. Moving on to our team's first argument. So these days about more access, these days the company's business model is to earn as much money as they can possible in any kind of business. Our side believes that this is going to lead to very unfair prices just for the sake of profit, because and so it's going to lead to less people having access. Our side believes that firstly, people who are in life endangering situations are usually people who have less
You know
money.
why?
Because yes.
But don't you think that definitely medicines like this, which people need to take, are necessary and they don't actually need to pay money for it just to actually fit into the society?
That's actually our point. That's why we're banning them from earning money from these things so that they can have more access to these things. So moving on, because these people who are in these kind of life and dangerous situations usually have really less money. This is because they have less of a chance or condition to truly take care of themselves. Our side believes that in this case, and we're making so that they have less access to the medicine to the people who need medicine the most. Our state believes that the situation is simply very unfair because the price is too high, so that the people who really need it cannot have any access to it. Our state believes that we're taking away the opportunity for these people to live. Moving on to our team's second argument, which is about how life should not have price. I believes that it's very morally wrong to save a person and then ask for money, because life is actually the most important thing in our society. People's lives are very, very important because it's a person's life. And our state believes that it's morally wrong to just save a person and then say, give me money for saving you. Our state believes that because there's no price of this is because there's no price on life. For example, lifeguards and firefighters, they do not ask for a price after saving a person from a dangerous situation. Our side believes there is nothing different in the case because they're both life-saving acts. Our side believes that life is valuable. However, op is taking away the opportunity for these people to live. So the impact of this is that life-saving acts always have a if life-saving acts always have a price. Our side believes that people might not get the care in emergency situations, especially in the case of poor people when they go out into society and maybe they have a very life-endangering disease like cancer. And our side believes that if this image spreads that life-saving acts should always have a price like life-saving medicine, our side believes that people might not get the care that they need at the same time, endangering people's lives. And our side believes the op is taking away the opportunity to live. And so our side will ban companies from making profit from life-saving medicine because we want more people to live and because life is very important. Thank you.
While banning companies from making a profit from life-saving drugs might seem like a significant threat to the economy, life-saving drugs are actually the main kits where the people who are diagnosed with like diabetes, etc., can save people's lives. As the name says. Before I move on to my two argumentations today, I would like to rebut the previous speaker. They said that this is taking away the opportunity for people to live. However, this is not taking away the opportunity as it saves people's life. That's why it's called life-saving drugs. That is used for diabetes. Also, They also have said putting price on saving lives is not essential. However, for diabetes or cancer or life-saving tools, we definitely need to pay money because life is not free. Also, companies who make drugs can make profit but have insurance for other people to pay. Also, they have also said that this is just to earn money. However, this is not for profit, but it is actually for the benefit of life-saving drugs. It is harder for people to collect these things as they grow.
POI,
Yes.
if you think that life is not free, so if you save a person's life, you should get, you should pay money, then do you believe that if someone is falling on the street and dying and you save them, they should also have a price tag?
We never s- it it doesn't mean like that, but people who have profit does not always mean like life-saving drugs. Of course, people will buy these life-saving drugs for people to survive. It's not only about that. Now to keep going, also life is something important, but making drugs are very, very difficult as making these drugs does not only apply to saying, oh, you need this for free because you need to sometimes save people's lives. Also, there is definitely insurance companies to help. Now to move on to the opposition's arguments. The opposition's first argument is that this saves people's lives. Life-saving drugs are actually part of making people wanting to be part of the society. However, if companies are just like banned, even in the best case scenario, the people who need life-saving drugs will depend on them, but will eventually end up in the hospital. No, thank you. Will eventually end up in the hospital because it's only gonna be saying, oh, as there's no insulin anymore or a type of medicine that needs to save my life, I won't be able to survive, so I need to end up in the hospital. Not only will the company be affected by this, but the people who use it as medications will be affected as well. Making profit does not only mean that it is going to save people's lives.
POI,
No,
ma'am.
no, thank you. But these medications are given by the doctors or even just suggested. Also, if this saves people's lives, then why are companies making profit a negative thing? So the mechanism of this is how, for example, there's giving insulin to the people who have been diagnosed with diabetes to not get too low or too high on their blood sugar. However, but how is this a negative thing when even if you need to pay money and there's insurance, it's not like you're gonna be saying, oh, we should ban this because it's a waste of money because life is not only about pain. Now to move on to the opposite second argument, which is it will stop people from getting proper medicine. Banning companies from owning patents or just like life-saving drugs could stop people from getting proper medicine because without the incentive or like the thinking or the thoughts of patients and the potential for the profit, companies would be less likely to invest the enormous time and the money required to research and develop for making like maybe like life-saving drugs a better thing. Also, also, if these life-saving drugs were like banned, it is going to be harder to recover from these diseases as some might not be fit to the other medicine. As I said before, it will not only affect the company, but it will affect the people.
Not disagreeing with life-saving medicine itself. We're saying that making profit out of saving a person's life and out of giving people medicine to save life is should be banned. And okay, so Judge, let's simplify the debate. Opposition fails to win this debate, even at the start, because they fail to notice the reason why there are many people who need life-saving medicines in the get-go of the debate. Mostly those who are incapable of taking care of themselves are the ones who get cancer, are the ones who get life-enduring illnesses because they cannot get as much injection shots or day-to-day care as the rich does. They make a society where the majority of those who get sick and get in life-saving danger could not get any treatment. So what impacts does opposition have on the society? Basically, only those who are rich, the minority who gets sicknesses, who got life-endangering illnesses, can survive. So why are the poor's life also important? The poor is also important because number one, they're the majority of those who get sick, and number two, they live through the same time.
POI.
No, thank you, ma'am. They went through the same times and their life has as much value. You grew up with your parents' love, not in relation to any of the money that you have. More than proud to propose. Moving on to our rebuttals against the Prime Minister, we believe that the Prime Minister doesn't have a clear idea of what they should prove in the debate. Like I said before, all of their case was about defending life-saving medicine itself and about how life is not free and life is unfair. Mrs. Speaker, remember, firstly, rebutting how life is not free and you need to pay money for whatever, whoever saves you. So when I POI'd her and talked about, no, thank you, people falling on the street, and if saving that life is going to cost money, they lingered around and didn't answer anything. We don't see how this is different from medicine itself. We don't go around asking for money because someone who fainted on the street is, and then you saved their life. We don't go around asking for money. Even so, we believe that if there is a poor person who is going in life-saving danger, who might die if they don't get cancer medicine, and then we go asking for money, we believe that this is very unjust. And opposition also agrees that they also create a world where life is not fair, free, especially which it creates a especially unjust society for those who can't pay and fend for themselves. Number two, they talk. Well, thank you. Talked about how profit is a potential, but if they get profit and potential, they will abuse the power and create a monopoly, like I said before, I will say right now. Let's go through the steps about this together, Mrs. Speaker. If companies get the power and authority to control life-saving medicine, a monopoly would happen. Why? Because they would increase the price so that they could get more profit as a whole. So what kind of a society will this create? 3 levels of analysis. Number 1, the poor would not even be able to get health care, even if they are very, very sick. For instance, if they got cancer, they wouldn't be able to pay for that medicine because it would not be free, because they would have to pay money, which will be the majority, like I said before. And second, some normal people will also have trouble paying for medicine and feel a burden to healthcare. Why we don't want this? The reason why we really don't want this society to happen is because healthcare should not be a burden, rather a responsibility to take care of yourself. If we put a price tag on healthcare, then it will make people feel more of a burden to getting good healthcare, to saving yourself, and saving yourself would be less of a priority than money. So third, it sends a message that healthcare is only for the rich, not for the poor. Why this message is negative? It adds on to the social injustices created, where if you are born rich, you get all the benefit, and it also leads to people disrespecting the poor. Mr. Speaker, in this debate, we all agree that life is valuable, right? Because you were born with love, courage, and also has the value of life no matter, and your money does not decide your worth. Your money does not decide whether or not you get the medicine to live, and that is why we believe that proposition takes its case on today.
The opposition the propositions claims that life-saving drugs are part of medicines, and that people should not pay for these medicines because these are life-saving medicines, and that people really need to live. And also, but however, this is not really making sense, and this is not really making sense. This is because yes, they're right. Life-saving drugs are life-saving, obviously, but however, because they are life-saving, people who make these drugs should be allowed to get money, because life means life is very important. So it costs money for people to make these drugs and sell it to others. Let's take medicines as an example. For medicines, people in the hospitals make medicines because of the sick people, and they get paid when people pay money to get these medicines to get better. But what about drugs? They are also life-saving. They act like a medicine, and when people sell it and give these to others, people should be allowed to get money because life is important, just like they mentioned. So this means that their argument doesn't really make sense, and also they didn't really clearly state their argument, so it was really hard for me to rebuttal their argument. So this shows that the proposition has failed to clearly state their argument, and now moving on to my arguments.
POI.
Yes.
So you're like an object, if it is important, it should also have expensive costs, no matter if it's life or just a normal object that we see on the mall.
Yes, so people should, because it's life-saving, people need it. People should get paid for selling those money because they save someone's life. So this requires profits. So now moving on to my argument. Our side strongly believes that people should be allowed to make profit and sell drugs because there will be job losses. The government could say they can just find another simple job. It's not end of their lives. But however, that's not the case. People who make and sell life-saving drugs are professionals. They've used and invested their precious time to study and learn how to carefully use and make, no thank you, make drugs. So basically, these drugs are also type of medicine that people create. If people are allowed to sell specific types of medicine that and earn money, why are life-saving drugs not allowed and not allowed to make profit on? They can be life-saving for some people, and we need money to make medicines. What? So you talked about how people should be awarded for what they did for like etc. But for fire like fighters, when they went to the gym to practice out, and they practice a lot of fire drills and they receive no money. What does it mean? Well, firefighters, what about that? Firefighters do get money for a job of firefighter. Now moving on to my argument. And for example, there's a big company that sells life-saving drugs, and that could have and many people work in that company. But if the government says that no selling drugs and making profits are allowed, the hundreds of people would lose their jobs. So to conclude, selling drugs that can save people's lives, just like medicines, are part of a business in this society. So banning this would give a huge impact on the professional workers who've used their precious time and invested their time to study and learn about drugs. And I would like to end my argument by saying a stance drugs are part of medicine that people sell and consume, and that can save people's lives. Thank you. The opposition side doesn't understand the value of life. When they directly came to the podium, talked about the value of life, and then suddenly talked about how life is more valuable than money. We believe, Madam Speaker, that life, how much it might be, even that person might not help society, believes that every bit of life should be valuable, and that it shouldn't be more valued than a piece of paper. Now, to the first main clash in today's debate. If life-saving medicine drugs need a price on them. Mainly, what opposition side said is that companies don't have any incentive. But as our first speaker has already said to you, Madam Speaker, is that companies, if they don't have any money, government can fund them, as any non-profit organizations or any non-profit company can also do to the government. Second, they said that life always needs money to support their life. So basically, a rebuttal is that it's life. And people, if they don't have enough money, as our second speaker said, because they're usually poor, not to have a stereotype, because if they don't have money and they have a broken leg, they faint because the weather's too hot, they don't have the money to suddenly come up again, earn money, and then give the money back to the doctors. They don't have the time and they don't have the length to actually give back the money. POI. Yes. Don't you think that it's better for like the people to actually earn money? But don't you think that there's emergency calls for people nearby to call for people if they're hurt? Not, yeah. So basically, you can't always then your world is a place where people just don't really earn their money. You frame this world like this, where people don't really earn their money and just ask other people to give your money in times of need. These individuals in our world can actually have an independent life, an individual life where they can actually root for themselves. And this isn't related. It's not like every day when you fainted because the weather is too hot, you can suddenly wake up, get a phone, call your like distant relative or something, and grab their money out of their wrists. Continuing again. So with your explanation, they agreed that people are objects in the mall because they need to be bought by money. So why we think people don't need a price tag on them is because people, they are lives. They are the very things that make up our society and the world. So because of that, proving again, these people don't have any time. They don't have any space, or they can't just wake up out of their hospital bed to buy some money, buy something, and like get out of their bed and try to buy something, try to phone somebody to give them money. They can't simply do that. In opposition, you can't just be dependent on some other person to receive your call, yes? Don't you think that there's something called insurance where if you don't have money, you can actually use insurance? But for these people, there's a lot of people who don't have insurance because they don't have a lot of people don't really pay their money to insurance. And even though insurance covers some part of what you're supposed to pay at the hospital, it's not like the insurance will cover everything. They still have to pay some. And as our second speaker has already said, but that these people don't have enough money. If they had money, they wouldn't be poor in the first place. So, anyways, opposition cannot win because they can't answer when in the case where somebody faints and they can't help and then they need to get help and somehow get money. What if they can't be dependent on one single call that would give them some dollars? Even what if the person doesn't answer the call? What if the person doesn't give them money? They have to find another solution where their solutions won't work. And also, their argument is it talks about saving people's lives. It talks about how like life-saving drugs are so important and whatsoever. And because of that, since they are so important, they should not have a price. They should not have a price tag because the people don't have the time, the people don't have the urgency to do whatsoever. And because of that, Madam Speaker, we believe that the government side has took this debate home. Thank you.
We are debating under the motion this House would ban companies from making a profit on life-saving drugs. And our team is mentioning that it will stop people from getting proper medicine, and also it saves people's life, and also it can lead to job losses. But the government side is keep talking that people who desperately need medicine can't get the medicine, and also rich person can get the benefit but poor people can't get the medicine, the life-saving drugs. Firstly, I will rebut the opposing sides during my speech, and the reason why our team won is the first clash. Which side can save people from infections? Our leader of opposition mentioned that it helps people's lives. For example, cancer and diabetes are serious injuries and they are not like cold and a little cough. And it needs a serious and efficient medicine like life-saving drugs, and those who need them could use them. And the government side is saying that people who desperately need medicine can't get the medicine. No, because of our leader of opposition mentioned, companies can make drugs and government can give it for free if you want. Like you're saying that we should give it for free, then and we can just make companies can have profit from the government. And the second clash is which side considers the reality. Our opposition side mentioned that it could lead to job loss because creating life-saving drugs and using those drugs needs professional skills. And if we don't let them to make profit, then they will not get can't get other jobs because they only work on that skills to like make drugs and like make it like safe, and that leads like so they can't go to for example another job that provides a lot of money to survive and leading to job losses. And the government team mentioned that we should make the medicine free because poor people can't afford them. By their logic, then we should make like doctors have to be free and food have to be free because if we don't have food, then you die. And the houses have to be free because if you don't have houses, then you die. And then they have to like they're saying that everything has to be free because if they don't have the necessary things then they all die. But this is not making any sense because we are not like this is not thinking about the economy and not considering the reality, and they're just saying like they're going to like make the life-saving drugs free, but their logic it is they're saying that there's coded words and their logic doesn't make any sense because it is not thinking about the economy as our team does. And also, their side is saying like according to their side, they're just talking about the poor and not talking about ordinary people who has cancer and diabetes, and they're just saying all the people is broke and poor, and they're not mentioning about us, like for example ordinary people or like rich people, and they're not like thinking about like poor, they're not picking they're picking poor people because it can be best for their sides, but our team is very necessary, and we our team believes that our team takes this debate home, and I'll mention this sentence again. Life-saving drugs are drugs that are sold and consumed to save lives, and we need to make it not free because their logic doesn't make any sense. Thank you.
This debate is about whether companies should make profit from life-saving drugs. The government said profit makes medicine unfair, but we showed you that profit actually keeps the system working and saves lives. Reality. First, without profit, companies lose the reason to produce and improve medicines. Making drugs takes years of research, money, and professional workers. And without income, these experts will quit. And that means fewer and new medicines and slower treatment for drugs that are life-saving. And second, the government said that even companies stop selling, the governments can sell instead. But that's not a real solution. Governments are often slow and efficient and limited. So instead of people learning medicine faster, they'll wait longer and more lives will be at risk. And finally, we defended the workers who dedicate their lives to developing cures. Their efforts deserve a fair pay of money for life-saving. And at the end of this day, government dreams about equality of every people getting medicine, and in their logic, every people are broke. But however, what we protect reality, a world where innovation continues about new medicines to save lives, even if it's a life-saving drug, and jobs stay alive in our world, and people get medicine when they need it. And also using their logic, like Arwood mentioned, food and medicine should be free because they said life-saving stuff should be free because they're life-saving, and this logic doesn't work. So profit really doesn't destroy life; it keeps them alive, and I think that's why our side, as the opposition side, takes this debate home and deserves the victory. Thank you.
Judge, the opposition side came up to the podium and talked about how if they follow our logic, everything that saves lives, food, clothes should be free. We believe that to solve this problem that opposition side have been complaining about speaker after speaker, we believe that even that food and clothes, they are in fact provided by the government for those who are seriously broke. The government does take care of these people. There are systems to take care of these people. That's what we're trying to do to healthcare as well, because it's also a system that takes care of people. And the reason why is because it is a necessity to live and to have treatment if you really need it. We believe that this is what we're trying to do, not what opposition side has made it look like. Opposition agreed that life is important, but also agreed that like an object, no matter if it's life or an object, it should be expensive if it holds significance. Why are they different? Humans feel things. Humans live through life. Humans are more valuable than any other object we can see. So let's simplify the world of opposition side throughout the long debate, Madam Speaker. 2 pushes that they made. Number 1, life-saving medicine is important. Number 2, life costs money and it should not be free, which was the points coming from the leader of opposition. So not everything in life should be free, we agree. But healthcare is different. Healthcare holds more value than anything else in life, because it actually gives life more value, because it saves the life, it makes people live more, it helps people live more, and it also saves a person and their soul, and also saves the person that has been loved, that has lived through decades, and also Finally, they talked about how researchers have studied years to make this medicine, but analysis, Mrs. Speaker, and clarification, Mrs. Speaker, most are doctors. They have other jobs, not only life-saving medicine. And even if, don't you think that the life of the majority of the society, those who are broke, cannot have any money, are more important than doctors who have, in fact, other jobs to do as well, more than proud to